Okay, let's start. Hello, everybody. Thank you for joining us today, and welcome to our webinar. My name is Konstantinos Antipas. I'm the chair of the TeleNursing Working Group of the International Society for Telemedicine and Health, and this webinar is organized by our working group, TeleNursing Working Group. First, I would like to invite Pirko Kuri, that is the Vice President of the International Society for Telemedicine and E-Health, and also the Vice Chair of our working group, to say a few words about the society, to present the Society of Telemedicine and E-Health.
Sorry. Okay, now it works. Takes a little time. So hello, everybody. As Kostas said, I'm the Vice President of the Society, and originally my first education was nurse, so I feel very comfortable here. And I also come from Finland, and I'm the Secretary for the Finnish Society of Telemedicine and E-Health. But you are most warmly welcome. Here is our board, and we have two of nursing background, Miss Claudia Pats, and I am, as I said earlier, and here you can see that we have international experts here, and they are happy to help you if there are any elements you need based on your work. And then I think the more important persons are Frank and Fredrik Lievens, who are also connectors and help us to communicate together and share information especially. Okay. We'll see if it works. Okay, now, as you can see, we have over 100 countries and territories, and we are really international. And we want to disseminate information related to e-health, telemedicine, or today we call it also digital health. And we are non-governmental, non-profit organization, and we have close ties to WHO. And we want to help national organizations, different societies like our Finnish society, which is the second oldest. So we work very closely with different societies. And very happy that we have telenursing, but I think that maybe students, if you study, continue your education or women group and education, I think they are the most common if I think the telenursing network. And then we can collaborate hopefully more together in the future. And you find more information from our webpage. And I think that the ISfTeH recognizes and values telenursing work because the nurses are the biggest group of healthcare professionals near the patients and citizens. So it's really important that we have representatives in our society. And especially in the home healthcare area and connected health, nurses' role is important. And today, when especially in Nordic countries, we have a lot of patient-centric care, and the role of patient is growing, and it definitely grows the role between, or the tasks between nurses and citizens or patients. It will grow, and we will have new elements in that sense. And our society offers, of course, networking opportunities when like this in webinars, and quite many societies organize their own annual conferences, and we are always looking forward to nursing sessions. And I hope that if you have something research or development work you want to share, please contact us, and then we can provide presentation in our telenursing session, for example. And also I encourage you to write publications and offer to journal. We have our own journal which has been sleeping this year, but we are convinced that it will soon wake up and we can have more publications there. And also there's a possibility to use newsletters. So if you have some information you want to share, please contact us, and then we can share worldwide to your experiences. So briefly, be active, follow our website and publish yourself. Thank you so much.
Dear Kostas, I think you are
Kostas,
mute.
you are mute, Kostas.
Yes, sorry. Can you hear me now? Can you hear me?
Yes.
Yes, thank you. Okay, as I said, I want to take the opportunity to present the TeleNursing Working Group before we start with the webinar. As I said, I'm the chair of this one, and I have the honor to have Pirko Kuri and Claudia Bartz, our previous chair, as vice chairs. We have about 150 members in our working group that are also nurses. And yeah, our vision is to enable nurses to extend their reach through technology while improving the quality of the healthcare delivered, and that's at the worldwide level. And our mission is to extend, to provide a forum for exchange of knowledge and experience of nurses and others who are working with or supporting nurses using e-health applications. If you are a member of our working group already, I wanted to remind you that we are here for you. We are here to connect you with other members and with the society, and to help you promote your work and to inform you about recent developments in our field. So please use our network. If you are a nurse and still not a member, I want to remind you that you can apply for membership at the website of the ISfTeH, the National Society for Telemedicine and Health, and the membership for nurses is free. And again, please do it and use our network. So now, moving to the main part of our webinar. The title is Supporting Nurses and Other Health Professionals to Choose and Evaluate Health Apps for Their Patients. And first, we're very happy that we have the European mHealth Hub that accepted to present with Belen Sotilos and Berglin Smaradotir. And they will present the European overview of health apps, assessment frameworks and repositories, resources, gaps and recommendations. And then we will have a presentation by the Norwegian Center for E-Health Research with Megan Corinne Broadway and Tilis Larby that will present recommending digital tools to patients, diabetes as a use case. Just to point out that I've been involved in the work that Megan and Tilis will present. So regarding the organization of the webinar, I would like to encourage you to send us your comments and your questions, but we will discuss them at the end of both the presentations. And please remember, you can write them in the chat, and please remember to write to whom do you address the question, who would you like to answer your question, or to whom the comment is going to. So please, Belen, can you please introduce yourself and the European mHealth Hub? And I will give you also the control of the...
Yeah. Thank you, Constance, and thank you for the organization to allow us to present these initiatives. I'm here in behalf of the European mHealth Hub, along with my colleague Berries Maradotir, that we developed the second part. I will try to explain you what is this hub about, and to present some results of our recent work that has been about health apps, and that could be of interest for the nursing community. Okay, so just a brief presentation. As said before, we are 2 people involved in this hub. myself and Berlin. She will introduce herself in a few minutes also. Well, there are many things to cover, but I will try to go to the main parts, and all the information is in the website and will be the final version there. So first is to provide you an overview of who we are, where you can find the information, and what was this work about, with some information about a collection of repositories, some visualizations, also some qualitative insights, and my colleague Berlin will focus on some work already done with the patient organizations and with some specific domains. So we have a website and also a promotional video. This initiative is born from an Horizon 2020 project. It is a joint collaboration from ITU, WHO, and ourselves, the Andalusian Regional Ministry of Health, Spain, that we became beneficiaries of this project after a tender process. I mean, we win the proposal with our colleagues, with our big group of partners. We are a consortium composed for more than around 18 partners, and the main thing is that we represent different countries and also different parts of the ecosystem. You can see it here. We have different implementers, also representatives from tech sector, academia, etc. And the main purpose, this is an action for sharing knowledge and innovation to foster the scaling up and the large scale of MHealth programs. Okay, we are developing several different initiatives. We will focus on what we name about KT1. It's about health apps assessment frameworks with the idea of access decision makers to provide grounds for common assessment, etc. We are also developing other work like policy framework, some contribution, and also we are developing a service portfolio and a business model and some work on ethics, because at the end of the day, when this project ends next year, the intention is to become the hub a sustainable entity. So if you go to the to our website, sorry, I went back. It is on gray, but well, you write European MHealth Hub, so you can see we have not only included the report but also some web-based content where you would see a nice picture of different frameworks that we have identified, and also repositories and the draft report that we are now finalizing. I have to say that this is not an exhaustive list because the main thing was that it was content in English. So if you have any other initiative, please, we are glad to hear about you and showcase that. Well, what have we done? We have done this research to identify these frameworks and also some the main domains and criteria. We have analyzed to what extent these frameworks cover these aspects or not. We have also had a webinar with the owners trying to be participative. They also provided feedback to their case study. And finally, we did a draft report. There has been a feedback period in summer, and we are moving forward to the final report. But probably other activities could be developed. So we had clear that there are several debates and ways that people understand the different domains, but sorry, the idea was not to get into an endless discussion about this. It was more about to give an overview and to help people to guide themselves in this big and numerous number of frameworks. I guess the organizer will share these slides. Here you have the different frameworks identified. These ones are yet in some way for the governments from different countries and so on. But we have also included some private ones or non-for-profit or other initiatives, right? So we have summarized 24 frameworks and many of them joined the webinar or provided feedback. So we have tried to validate the information. In this report, you would find these different parts for reimbursement. We have made like some specific consideration and also for how this market works and so on. And the recommendations, we have targeted them not only for the owners of the frameworks, but also for the users. So in this sense, I would invite you as health professionals to have a look to them, especially the one in the users, right? We are also working in some visualization. This is not the final version, trying to see how many frameworks have covered different things. So at a glance, you can see to what extent a specific part of effectiveness is covered or not, you know, so trying to find ways of showing information in an attractive way. And this one that I think could be of special interest for you as nurses, we have already also collected repositories. The main conclusion is that there is much heterogeneity in it because the size of the repository is very different. Some of them have only a few apps, others have a lot of them. Not always is clear that would be the ideal situation, but not always is clear if there is a quality seal or some kind of assessment process behind it. And also the user interface could be improved because sometimes some of them have filters, have others don't. So I would invite you, you can download it from the website and also in our social media. Well, and about the qualitative insights, I will not detail too much on that. Just to say that we have described different information that are not data or are not specific figures, but for example, how is the process of the assessment, what is the role of assessors, if there is some business model behind this framework and so on. So we hope this is inspiring for someone creating a framework or developing a new one, or even for the long-lasting aspiration of trying to make like a more comprehensive framework that you know that the Commission has worked on it several times. So I would end my part saying some specific recommendations that has the users as target audience. Well, I will not read them now. You have it here and in the presentation, but it's as usual to have the user in the front of the situation, and also to you know the effectiveness is like the place where more improvement area exists, because it's really hard to do it, at least in the standardized way. So now I would mute myself and I will give the floor to my colleague Berlin.
Thank you, Belen. I would like to start to introduce myself. I have a nursing background with 11 years of working as a nurse in northern Norway. I have a master's degree in telemedicine and e-health and a PhD in ICT focusing on telemedicine, e-health technology. I am a researcher in the European mHealth Hub. Next slide, please. So I will present briefly some results from the domains accessibility and usability, as I was one of the assessors. So here you can see the different criteria for accessibility, and at the bottom for user experience and usability. I'm not going into detail, but this is also public in the report already mentioned. Next slide. So I want to share some selected results from the analysis of those two domains. About 50% of the application frameworks address accessibility and user experience and/or usability. There were different levels of depth, with some presenting in a very detailed way, criteria, others at a quite general or superficial level. Several of the application frameworks provided links to relevant laws, standards, and certificates. But however, some of them failed to mention concrete design or evaluation criteria. Standards for disabilities or limited cognitive ability were not mentioned in application frameworks. Regarding the transparency of limitations, there were mentioned limitations in a general way, but not detailed on how transparency should be disclosed in a health-related context of use. Co-creation and user testing was mentioned in several of the application frameworks. Addressing representative sample of users to understand health requirement, healthcare context, and health interventions, but also field test and user friendliness of the graphical user interface were addressed. Next slide. So this slide is one of the examples of the usability metrics, one of the most detailed sets of usability criteria. However, mainly focusing on the user interface and technical issues, and less on the user experience. And that is how we experienced in many of the application frameworks that either mention usability or user experience. Next slide. And then we have the recommendations, what we come up with after our assessment. First, we have the accessibilities. We recommend that guidelines or standards would be of value to ensure accessibility and health app-related context of use to bridge a common understanding on the design for such apps. In health environment, it is especially important to adequately include all potential target users. And one more click, then we have usability and user experience. Frameworks need to provide criteria, justification, and guidelines publicly available. These elements would provide developers, users, and authorities with useful information to apply and assess health apps. Next slide. And I will also share some results from a qualitative study of patient organizations or the experiences of patient organizations. We made 5 digital interviews with European organizations and desk research and email communication. So in total, 6 organizations were included. Next slide. And some selected findings from this study is that patient organizations, they do have health apps on their agenda with a guiding question. How can self-management and everyday life of our members be supported? Challenges that were addressed by the organizations were particularly safety and reliability, and data storage and privacy. Also, lack of transparency in the health apps was mentioned, with statements such as who funded and created the health app. And regarding accreditation, reliability, and validity, a statement or question was addressed that who advised the medical content. And several of the organizations had user panels and technical experts group. So regarding health services to use and recommend mHealth apps, it was stated in the interviews that the conventional organization of health services does not specifically include mHealth as a core element of the care. But in order to achieve this, it would help with objective verification of reliability and validity made by governmental institution, patient organization, or a third trusted party. So to conclude with some other findings also, it was mentioned in the interviews that a challenge is the pace of technological development and the overwhelming amount of new and available apps. It was also addressed user involvement and co-design to meet personal needs and involve users. Some of the organizations had been part of co-design processes, but it was mentioned by one of the organizations. However, one single patient once is not enough. Continuous user involvement through entire development cycle, updates and refinements were mentioned as important. And finally, a kind of problem statement, which problems can be solved by mHealth solutions. Well, the organizations said some, certainly not all, but some of them. So it's about identifying which daily problems to solve. Thank you. And here is the contact information to the mHealth Hub and to Belen Sotilos and to me, Berglind.
Thank you. Now Megan Broadway will present. I will give you the control.
Yes. Can you hear me?
Yes.
Great. So I'm representing the first half of this this presentation. Dillis will present the second half. We're from the Norwegian Center for eHealth Research, and we'll be presenting 2 studies within the Diabetes Digital Guidelines project. And this is funded by Helse Nord, and there's our project team. In the interest of time, I'm not going to say everybody. Let's see if my controls will work. They were working earlier. Aha, there we go. Okay, so the project overall goal was to develop guidelines for evaluating specifically diabetes self-management apps and online resources. We had noticed that there were a lot of the frameworks and such out there. It seemed like they were taking on too big of a chunk in order to get down into the details of what guidelines should be for apps and online resources. So we focused on diabetes as our use case. Okay. Sorry, it seems to be a little bit delayed. There we go. Okay, so for the first study, which I will present, is about patient needs. So we were comparing patient reported needs versus reported research outcomes. The second study is the Delphi study, which identified information that healthcare providers said that they needed in order to evaluate, choose, and recommend diabetes self-management apps and online resources. And then the purpose of that study was to reach a consensus about those guidelines. And Dillis will present that after me. So I'll focus on the patient needs studies. The question that we wanted to answer was, is research producing the information that patients need? So we have some of the answers that you were mentioning, Berglind, about including patients from the very beginning and addressing their needs from the beginning in frameworks and research studies, and not just at the end, not just testing a developed app or online resource. So just an overview of the method that we used, we compared scientific research publications. We did a systematic review, and we compared that to published literature and reports. We just searched in Google. For one of the things that we did is simply searching in Google patient needs, patient-reported needs, unmet needs. So in the scientific articles, we looked for interventions or evaluating a device or a system for diabetes self-management, and in Google and these other kind of gray literature as they're known, we looked for patient-reported needs related to mHealth, and also just about diabetes self-management in general, because we also wanted to know what needs inherent to dealing with a chronic illness are there, and is technology addressing those? So we looked for where these two concepts overlapped, which is hopefully a large overlap, which means that we would be addressing a lot of the patient needs in research, or if it was more spread apart, in which case we unfortunately have a lot more work to do. So first we looked at what is research reporting. So we looked at studies that reported the evaluation of these mHealth options, and the data extraction included things like what methods were used in these studies, these interventions, who was included in the studies, were healthcare providers and patients part of providing input, and then the type of data gathered and the reported outcomes. And the reported outcomes are what we used to compare in this first study. So we focused on the reported outcomes. And then what do patients need? We looked at the patient reported needs, and then also facilitating factors related to diabetes management, like access to certain resources or family support, such like that. So it was both general self-management needs, as I mentioned, and also the needs related to mHealth technology specifically. So this is just one example of a topic, so support from or access to resources, where we were able to see specific and unique needs from the patient perspective and from the researcher's perspective, and then how and where they overlapped. So, for example, under this general topic, research reported about coordinated healthcare. In these cases, this generally meant coordination of healthcare between healthcare providers. So, did GPs and specialists communicate, or within a care network? Patients' needs related to this were more about self-management aid options. So while one concept means one thing to research, it may mean something completely different to individuals. And I think this is something that we need to be aware of when we're performing studies, when we're even beginning studies, and also when we're looking into frameworks. So one overlapping concept was relevant diabetes information, and then patients said specifically self-management performance feedback. So while research can report an important concept, individuals can report specific examples of that concept that we as researchers and healthcare providers need to focus on in order to address their needs. I'm going to hand it over to Dilys now, and she's going to present to you the results of the Delphi study.
Hi, so I'm Dilys. I'm an advisor at the National Center for E-Health, Norwegian Center for E-Health Research. So I'm going to talk about the Delphi study we did within this project, the Diabetes Digital Guidelines Project. So the Delphi study is basically a method which is used to establish a consensus among a panel of experts for a particular topic or issue of interest. For our Delphi study, we wanted to establish a consensus among healthcare professionals in Norway on the criteria for evaluating, choosing, recommending digital diabetes self-management tools, which are basically apps, websites, and social media. We also wanted to explore the healthcare professionals' perceptions of these criteria. And by criteria, we are basically talking about the type of information that individuals use to form an opinion about these digital diabetes self-management apps, websites, and social media. Okay. Yes, thank you. So between March and April of this year, we contacted 45 healthcare professionals in Norway with diabetes care experience. And finally, we ended up with a panel of experts of 15 healthcare professionals from all the health regions in Norway, which is basically all over Norway, southeast, north, west. So we had, of the 15 healthcare professionals, we had 2/3 of them being nurses. And can you click, Megan? Yes, so we had 15 healthcare professionals, and then we had 10 of them being nurses. We have 3 medical doctors, 1 occupational therapist, and 1 clinical dietitian. Next slide, please. In order to achieve this, to do this Delphi, we sent out 3 rounds of questionnaire, which was based on the evaluation criteria we got from the systematic review Megan talked about, and we had 8 criteria from this systematic review, and then based on for these criteria, we asked the panelists to rate the importance of the criteria for evaluating and patients choosing and healthcare professionals recommending digital diabetes self-management tools. We also based the criteria on the interviews we did of stakeholders in diabetes care. Can you please click? Yes, so by stakeholders, I mean we included individuals with diabetes, families with families of individuals with diabetes, living with diabetes. We also included developers and researchers of digital diabetes self-management tools, and also health authorities. We also found some criteria, we extracted some criteria from these interviews, and then we also asked the panelists to rate the importance of these criteria based on, for the importance of these criteria for patients choosing and healthcare professionals recommending the digital diabetes self-management tools. Next slide, please. Yes, so for the results, so I'm going to give the results according to the 3 self-management tools and services we considered, which are apps, websites, and social media. So for apps, I'm going to just present the 3 most important criteria that the healthcare professionals agreed on. And that's for evaluating, we have usability, feasibility, and behavioral impact. For choosing diabetes self-management apps, we have the important criteria are usability, feasibility, reliable and quality information. For recommending the apps, we have usability, the criteria are usability, reliable and quality information, automated data recording. Now, usability is common to all 3, which is evaluating, choosing, and recommending. And then we have reliable and quality information, which is common to choosing and recommending digital self-management apps. Next slide, please. For websites, the panelists thought that the 3 most important criteria for evaluating, choosing, and recommending these websites are, click please. these websites are for evaluating, they considered usability, clinical impact, and feasibility as the important criteria. For choosing, they considered feasibility, acceptance, reliable and quality information as important criteria. And for recommending websites, they considered usability, clinical impact, reliable and quality information as important. For social media, we have the three most important criteria that the healthcare professionals considered were for evaluating. They considered usability, acceptability, and feasibility as important. For choosing social media for self-management, they considered feasibility, acceptance, reliable, and quality information as important. And for recommending social media for self-management, they considered clinical impact, feasibility, reliable, and quality information as important. And we realize here that they consider for reliable and quality information, it is present in all three self-management apps, tools, and devices, which is apps, social websites, and social media. Next slide, please. Yes, so we also asked the questionnaire also asked the panelists who they think should evaluate diabetes digital self-management tools. And we had several answers, but then the ones that had the highest scores were all variants of a suggestion for a working group that consists of stakeholders with different competences, and that should include healthcare personnel who will assess the efficacy and impact of these digital self-management apps, websites, and social media, and IT personnel who will look at the security and privacy of these self-management tools, and then a user or a representative of a user organization who will evaluate the value and usability of these tools. We also asked the panelists how they think we should make available the criteria, the list of criteria that we have to them to be able to evaluate and choose and recommend diabetes digital apps, websites, and social media. And they suggested they made a lot of suggestions, among which they suggested that we should make it accessible via relevant websites, such as the websites of health libraries, and also to have an app which contains a collection of quality-rated digital tools, which they can just choose, look at the ratings, and then choose from that. Yes, so thank you for listening. These are contact information for Megan and myself. Thank you.
And sorry, I just wanted to mention that one of the slides, one of my slides was missing. So I've included the link to the paper that describes research reported outcomes versus patient reported needs. I've included that in the group chat if anybody's interested. Thank you.
Thank you. And thank you all for the very informative presentations. I would like to now to participants to send us questions, or if you that you're presenting have questions to each other, go ahead and ask either by chat. I think it's also possible to give you the enable you to talk. In the meantime, I want to mention that there are some upcoming relevant events that might be interesting for you, organized by the International Society for Telemedicine and Health, or are related to that. One is today at 6 o'clock Central European Time, and it's about the expansion of telemental health in the time of COVID-19. There is also tomorrow another webinar by ISfTeH about teleurology before, during, and after the COVID-19 pandemic. And also, you can also ask Pirko for more information about that. It's the international conference, but also it's the Finnish conference for e-health. 1st of October, free participation for 100 participants, and you can find the information here, and you can participate and also look at the program. So I see here we have a question by Michael Cardinal. in terms of feasibility, does your paper go more in depth in terms of what clinicians consider a feasibility criteria, interoperability, price, etc.? Would you like to answer, Megan?
Yeah, this is actually probably more about the Delphi study, but we're in the process of writing up the results of the Delphi study. But there is the results of the systematic review that we completed. I can put the link to that paper in the chat. It's available on JMIR, the online journal. So I will go ahead and copy and paste that into the chat, and please feel free to read it and contact Dilys and I, actually, or Kostas, about any of those details.
Hi, this is Claudia. I have a question, if I could. I suppose to all presenters. To what extent are apps used by patients, people with healthcare needs, diabetics or other, in your environment? Is it a new thing, or is it something that is sort of overwhelming the environment, and you're concerned with establishing reliability and validity and usability now that there are so many apps? I'd just be interested in sort of the history of why you're looking at these topics. Kostas, you're muted.
Yes, always the same mistake. Yeah. Would Belen or Bergling would like to comment on your question first, and then Megan and Dilys?
Yeah, sure. Well, actually, we base our work on the existing framework. So probably Berlin could have a more fresh impression because she consulted some patient organizations, but the rest of the work was made to see what different frameworks had done and to what extent they were going towards a similar direction or not.
Well, I can share some experiences from the Norwegian Diabetes Association that I interviewed. They provided an issue of the member magazine with a 15-page article about apps and sharing their experiences. So absolutely, apps are in use among, for instance, in this case, diabetes patients. Focus on user friendliness, price, and what is the goal of the app? What does the app do for you as a user? Well, that is an example.
Megan or Dilys, you have can you comment?
Dilys, did you want to go ahead and try?
Well, the only thing I'll probably add is that when we did the Delphi study, we did ask the panelists their experience, how they'll describe the patients' use of apps and websites and social media in their daily practice, and it seems to be quite high in that sense. So I think patients are kind of really using these apps to self-manage, which is very important that we look at it and try to make sure it's safe and effective in its use. That's what it's intended to do.
Yeah, and from our other research at the Center for eHealth Research, this is actually very much related to my PhD. We've done co-design workshops with individuals with both type 1 and type 2 diabetes, as well as specialists and GPs. And there's a lot of individuals are coming and saying, we've gathered so much information and there's only so much that we can understand from these apps without the, the complementary knowledge of healthcare providers. So people are using these technologies to the best of their ability, but they still have additional questions about how to interpret different situations, how to interpret their health. So the data is there, the use is there. We simply need to understand more about how individuals are using them, about their needs, and then how we can implement it into care in the most, mutually beneficial way.
Thank you. Yes, thank you.
I have some more examples from the patient organization study. We had the Danish Multiple Sclerosis Society. The patients wanted not general feedback. They wanted like, what is important for me in the apps? So
Yeah.
for instance, regarding activity or monitoring activity. So what kind of activity is good for me? And when is the activity too much for me? So more smart or artificial intelligence that was like tailored for the individual. Not general advices, but personal advices.
Yeah, I can emphasize that is a huge focus of a lot of people in this research field, and that we found too. So very consistent.
Very good.
I also have a question. It's a bit related to that. It's for all of you. Do you think that we as nurses have a role, or health professionals have a role in suggesting health apps, or we should expect in the same way that patients are ready to make decisions about their health? Of course, they are ready to make decisions about their health, but also like in Norway, they decide to which hospital they will go. Or we should expect that this is something that patients can and users can decide themselves. Do we have a role in this suggesting or prescribing apps?
I can make a short reply. We do have a role, but I know from another study for depression management, the interviewers, the interview objects were like patients at home. And they said that the health professionals that recommended the apps seemed to not know the app. They couldn't help me. They just recommended it, but they couldn't help me or say it's good for this or good for this, or you do like this or that. So they requested more user training, and that the health professional should be like more informed about things that they are suggesting.
Thank
Yeah,
you.
I can also follow up with a comment about that. We found the same thing, that healthcare providers, especially specialists such as endocrinologists, were saying they don't have the time or the resources to familiarize themselves with all of these different technologies that are available. So while we're still working on this kind of problem, I firmly believe that healthcare providers have a role in collaborating with their patients about the use of the technology. So unless we give healthcare providers, and especially nurses, because you spend so much time with these patients, unless research and health authorities are able to give you concrete ways to recommend and evidence-based ways to recommend, I think in the meantime, an approach can just be to have conversations and share kind of a plan with the patients about like, okay, if your problem is this, why don't you collect this and this data before our next meeting, and then we can discuss your progress. So it's more of a collaborative tool. So I think if nurses and other healthcare providers can be proactive about supporting the use of these tools in a way that is helpful to both the nurses to understand their patients and to the patients to, self-learn about their own situations. I think that can be a solution while we're waiting for these other like recommendation guides to become available, so that nurses don't feel like it's all on them or all on you to try to figure out what's best out there.
I agree with both of you. But regarding like waiting for the guidelines, I don't think nurses should wait for any guidelines, and that's a role we can have as independent professionals and as part of our independent practice, to be able to look at the patient needs, to look at the literature, and like make evidence-based decisions also about apps as literature becomes more and more available, more and more studies are published, and this is like also a need to have more evaluations of apps of clinical effect, so we can also as health professionals make informed decisions and more informed suggestions to patients.
I think also the partnership between research and nurses, because your experience is so valuable, and the diversity of your experience is so valuable, that I think we need a greater collaboration, so that we're also producing the information that you need as healthcare service providers.
Just to go to the chat and see the comments we have here, it's Michael Cardinal commenting that to add to the debate, according to the use of our app prescriber, I guess it's an app or a program, 75% of the psychologists in private practice recommend apps to patients, and 50% of them received questions from their patients regarding, I guess, the apps. And 32% of patients with diabetes use mobile health apps according to our works. And this data comes from the servers, or before the use of our app prescriber. And then there is another comment by Georgina Hobson. Thank you for an excellent webinar on health in European context. I'm in Australia, but this has given me valuable insight into current work and research, and it would be very useful to really, this is my response, that it would be really useful to hear from you how things are in Australia, and if you have similar experiences there. Diana Whitehouse comments that Megan commented especially, what a concept may mean to research is something entirely different from what it means to individuals. What do you see as the main challenges in bridging this gap, especially when Europe is encouraging people and professionals to get more involved in real-world data collection and data use to do research among other activities? Megan, would you like to comment?
Yeah, great question. So research often produces, they design studies, they design research questions based off of what they assume patients need. So a lot of their outcomes are very general. So I think one thing that we can do is involve individuals and the end users, so patients and healthcare providers, in the design of these studies. So in the design of the research questions even, so that we're producing the information that is needed by those who will actually be using these technologies. And this isn't a new concept. It's called co-design and participatory action research. So I think if we put more emphasis and collaboration between patients, providers, and researchers through that method, I think we'll be able to produce a lot more useful and relevant information. So those Venn diagrams that I showed would be, more or less overlapping instead of just kind of touching.
Adolfo Sparrenberg, also very a member of ISfTeH, and I think member of the board, says, congratulations for the very nice and clear presentations. One question from my side, are you including the analysis of non-invasive glucometers as part of the evaluation process? I guess this goes to Dilys and Megan. But I don't know if it's also relevant for Berlin and Belen. Megan or Dilys?
Yeah, sure. We were focusing more on apps and online resources in our systematic review, because those are the types of technologies that have the least amount of, there's no one set strategy for how to evaluate those. Usually glucometers and glucose meters, those that are considered medical devices, have their own set of standardized ways of performing evaluation. We focused on mHealth apps and online resources that currently don't have a standard for evaluation. But there are absolutely studies out there that can provide that information.
Thank you. And Ayotunde Joseph Awoso says, hi all, happy to be here and develop telemedicine more in Nigeria. Already a startup has been recently operationalized to this effect. And that's very interesting. And also, I hope the European experiences are relevant for you. And one of the intentions of our working group is to also present experiences from other continents. Just yeah, now it happened, it's from Europe. And I know also that more European initiatives comes to support e-health in Africa, that the European Union has recently a call about e-health policies in how to support e-health policies in Africa. And this is also going to help the collaboration between Europe and Africa. And then it's Michael Cardinal, as long as information is provided to nurses, seeing information on 10, 12 apps is not enough to be reliable, as the market for diabetes, for example, has more than 1,300 apps, 1,300 apps, yes. But now it's already over 4 o'clock. Thank you very much for these very interesting discussions. I don't know if you, Berglin, Belen, Dilis, or Megan, you have a comment?
Oh, thank you. It has been a nice webinar with many participation. Thank you.
Yeah, thank you for letting us speak about this and share our research. It was very interesting also to hear from the mHealth Hub. So, yeah.
Thank you very much, and thank you for those that are attending their seminar, webinar, and hope to see you in our future webinars.
Bye.
Thank you. Happy
Bye-bye.
Tuesday, all.
Bye.
I just, I think.
Thanks, Costas. Good job.
Thank you, thank you. I don't know if I stopped sharing, yeah.